Hello, my name is Dr. Ruth Vine and I'm the Deputy Chief Medical Officer for Mental Health with the Department of Health and Aged Care. This is my final video for this year's Mental Health Awareness Month. This week, I want to talk to you about a few groups who have had it particularly hard in the past few years and why it's important to look after your mental health. First, I want to discuss mental health in children. Research shows that the foundation for lifelong mental health and well-being are pretty much built during childhood. A child's emotional well-being and mental health is shaped by both their biology, genetics, and the environment in which they live and grow. Evidence indicates that the first 2,000 days of life, the first 5 or 6 years, are a critical period, and interventions during this time can result in significant improvement to a child's early life experiences, health and development, their sense of who they are. The prevalence of mental illness for those aged 14 to 11 years is estimated to be around 14%, and for those aged 12 to 17 years, a bit over 14%. An estimated 50% of adult mental disorders and illness begin before 14 years of age. Despite this, 7 out of 10 parents aren't confident they could identify the signs of social or emotional problems in their child or know where to get help. Fewer than half of parents are confident they might be able to do something to help at home if their child's experiencing social, emotional or behavioural problems. But we are working to make things easier for children and their parents through things like the Kids Helpline, which is a free, confidential, 24/7 online phone counselling service for young people aged 5 to 25, the Parenting, Education and Support Program, which is providing free universal access to evidence-based online parenting, education and support to all Australian parents and carers with a child under 12 years. The suite of parenting resources will enable parents and carers to develop the confidence, the skills, the strategies required to better support child mental health and wellbeing as children progress through key developmental milestones and help them identify potential problems earlier on. The Raising Healthy Minds app provides parents and carers with free access to information, ideas and guidance to help them support their child's social and emotional health and well-being. Developed by the Raising Children Network, the app is aimed at parents and carers of children aged 0 to 12. It's free to download and it's filled with tips and practical ideas to help families raise confident and more resilient kids. I will now discuss mental health in young people. We know young people aged 16 to 24 have probably the highest prevalence of mental health disorders across all age groups. In 2021, with nearly 40% experiencing a 12-month mental health disorder, an increase up from 26.5% in 2007. Young people aged 12 to 25 can access free or low-cost mental health and related supports from the national network of 150 Headspace services, in addition to digital supports available through eHeadspace, which is accessible by phone, email and web chat. The network of Headspace services provides holistic care across 4 key areas: mental health, physical health, substance misuse and social and vocational support. Things I think are looking up. A recent survey conducted by ANU showed that young people are reporting improvements to their mental health outcomes, life satisfaction and level of psychological distress over the past year, so coming down from the highs of COVID. Finally, we must not forget our older Australians, particularly perhaps those living in aged care. Unfortunately, many people over 65 still feel that there is stigma attached to depression and anxiety, viewing them as a weakness or a character flaw rather than a genuine health condition. Older people are more hesitant to share their experiences of anxiety and depression with others. They often ignore symptoms over long periods of time and delay seeking professional help, only getting there when things reach a crisis point. Of course, older Australians can access all the same supports as everybody else. However, specific mental health supports and clinical treatment are available for aged care residents through both Medicare and the Primary Health Network Commission services. Eligibility for treatment under the Better Access to Psychiatrists, Psychologists and General Practitioners through the Medicare Benefits Schedule, MBS initiative, was expanded to aged care residents and up until 31st of December 2022 in recognition of the mental health impact of the pandemic on this cohort. Aged care residents can also access mental health support through Primary Health Network Commission services such as Psychological Services in Residential Aged Care Facilities initiative. Under this initiative, PHNs are funded to commission tailored, age-appropriate supports and treatment for residents of aged care facilities with or at risk of developing mild to moderate mental health conditions. The Better Access evaluation, currently underway and due for completion in December 2022, as well as a recent evaluation of the PHN InReach initiative, will help provide insights and into effective service delivery models for aged care residents to ensure they can access essential and appropriate mental health supports. For more information, please visit health.gov.au and head to health.gov.au. I hope the videos this month have helped you to actively support your mental health. Thank you again for watching. Stay well, and I'll see you next year, maybe. Bye.